I'm totally against self-medication. Please do not take any medicines over the counter, any painkillers or any vitamins. You don't know what you are taking inside your body, what you're eating. So don't take any medication without doctor prescription, without discussing it with the doctor. It could be something that could be beneficial, it could be become a toxicity or poison to you. So please always consult a doctor, especially again, like I said, if I talk about vitamin D deficiency, you can have muscle weakness, muscle numbness, you feel very fatigued or tired, you have dry skin, your hair are not very healthy looking. So you will start getting all these little signs and symptoms. It's the best way is to get it checked and then properly get it treated by a doctor.
Absolutely. Very aptly put, and I think very informative as well. But I must ask you, because we were reading a couple of figures as well, which told us that there's a high percentage of osteoarthritis in Pakistan, especially in rural areas. It's gone up to 70%. What is that, and why is that happening?
Again, it's related to bone health. The bone health generally is declining over the time, over the ages. I think what you're referring is to osteoporosis. Osteoporosis means very weak, brittle, porous bones. You can suddenly develop a fracture without any major injury. More common in females above 60, postmenopausal, when the periods have stopped. Again, it's a silent problem, it's a silent disease. It only presents when somebody is coming to me with a fracture, either fracture of wrist or fracture of spine, and when I do the x-ray, I find out that the patient is osteoporotic. That means very extremely weak bones. And again, it is becoming very extremely common. Again, it could be related to hormonal issues, dietary issues, lack of exercise. You know, I tell you an interesting thing. When you exercise, your body regenerate or regrowth bones. So bone growth is actually very important, and it's related to exercise. So again, our sedentary lifestyle, our sitting lifestyle, not much of exercise, it can lead to weak, porous bones, and that can, in later ages, cause you problems.
Absolutely. So, Dr. Saiba, understanding what you mentioned about women, how many times should a woman go to the doctor for a general checkup, to make sure that everything is in check, especially regarding, arthritis and osteoporosis and whatnot?
I would mention some few general points that a female, especially a female, young female of a childbearing age, if they're having these symptoms for a couple of months and they have tried all the totkas and things, they should go and see a doctor. First of all would be extreme fatigue, extreme anemic or low energy. Second would be joint pains and stiffness. They would say they're finding it very difficult to do the household work. Number third thing, it could be something like numbness or tingling that's moving around your arms. Again, they will tell me that they find it difficult to hold their babies for breastfeeding or just to carry their babies. They find it difficult. Commonly people say that they can't climb stairs. If they do a walk of stairs, they start getting pain in their knees, like you mentioned, that will travel up to the hip. People will complain about back pain a lot, and they've tried all the painkiller, but it's not going away. And again, this back pain is radiating to your one side of your foot or leg, and it's again becoming numb or weak. So these are the main symptoms. If you're having all these symptoms, you've tried something and it's not getting better, please see a rheumatologist.
Absolutely.
Absolutely.
Dr. Saiba, thank you very much for joining us.
So
it's such an informative session, but I wish we could go on. We don't have luxury of time, but what we promise you is we're going to share Dr. Saiba's handles, social media handles, and then you can get in touch with her over Instagram, which is the most preferred choice. So I'm sorry if your DMs get filled, but that's going to happen. But thank you very much. A really informative session. And it's as Rebecca McIntyre said, that to succeed in life, you actually need 3 bones: a wishbone, a backbone, and a funny bone. So I think it's simple as that. So you need those 3 bones, but then again, listen to the doctors, listen to professionals like Dr. Saadia Riaz, and you're not going to lose your way. Please, this is a very serious issue in Pakistan, and it breaks my heart to see majority of the youth struggling with back and neck problems, and bone health as well is something that we really need to stress upon. It is a very serious issue.